Hello everyone, this is Dr. Lauren Gresham at Nutima Integrative Medicine. I've had a lot of patients and loved ones ask me about masks and my opinions on masks for the coronavirus, and I wanted to talk about that. I don't know about you all, but February 29th, the Surgeon General made a tweet critiquing the American public for hoarding up masks and saying they're ineffective for the coronavirus. And then also in the same tweet saying we need to save them for healthcare workers to protect them from the coronavirus. I was confused by this because I felt like on one hand he was saying, hey, masks are not effective, stop being a dork and wearing them. And then also saying, hey, masks are effective, that's why we need them for healthcare workers. I was confused. So I brought this conversation up with some healthcare practitioners I know and came to interpret it in a way that makes sense to me, in my opinion. This is my opinion. So the first thing I thought about is if you have a sick person who hopefully is not walking around, but let's say that they are walking around, maybe they don't know that they're getting the coronavirus and they just have a cough at this point, and they're coughing out in public, not wearing a mask, and they're spraying these viral particles through the cough all over various surfaces, which we don't know how long they even live on surfaces, but they're spraying it all over these public spaces, and then other individuals are coming and touching that ultimately actually becomes the highest risk for the general good. Because no matter how careful you are, like the likelihood that you're going to accidentally touch that and get it somewhere else on you, and then that will become a vector for you to get it into your own mucous membranes, is a substantially increased risk, especially if that person doesn't have a mask to capture those respiratory droplets. So from like a public health perspective, it really made sense to me that I was like, the greatest protective effect for everyone, including you mask hoarders, for all of us, is that people that have any kind of cough or symptoms are able to have access to a mask to protect people. And stay home too, please. Number two, healthcare workers that are knowingly putting themselves in high-risk situations by caring for sick coronavirus patients, that if they don't have masks, number one, they're at an increased likelihood of being a vector, meaning like spreading it throughout their communities. And number two, if you start having a bunch of healthcare workers dropping like flies, getting sick and having to stay home, then who's going to care for critically ill patients, immune compromised and people with pre-existing medical conditions that really need critical care? Well, then that poses an even greater risk to the collective good. So when I thought about it like that, I was like, okay, that makes a lot of sense to me, and I can see why hoarding behavior of masks is harmful for everyone. I think it's easy to just be self-centered or to be fearful and go into self-protection mode, but I think if you can reframe it as it's actually for all of our benefit, not just an individual's benefit, but also for their benefit, to make sure that healthcare workers and currently sick people have access to masks, that is the greatest protection to society. That made sense to me, which I'm not sure if that's what the Surgeon General was saying, but anyway, makes sense to me. Does that mean that I'm going to go in public and not wear a mask? I'm pregnant with my first pregnancy. I'm being ultra conservative and basically staying at home as much as possible. But if I have to go into a community setting, I am going to wear some sort of facial covering. I've been to Burning Man 8 times. I've got a lot of cool little masks and bandanas. And for me, personally, I intend to use essential oils with a light carrier oil on those devices and then launder them after use. Why essential oils? Well, supposedly essential oils and different aromatic plants were used during the plague by like thieves and robbers so that they could go into the homes of victims of the plague. And because they're breathing in these aerosolized these like antimicrobial compounds, they were less likely to get the plague themselves. There's a whole thing on Wikipedia if you want to look that up. But also there is some research that antimicrobial compounds can be helpful for different types of coronaviruses. There was a study out of the University of Georgia in 2009 looking at a type of coronavirus that affects chickens. And they did a bunch of different experiments with the chickens, exposing them to aerosolized essential oils, as well as directly spraying them into their noses, putting them in their drinking water, and then exposing them to a type of coronavirus that affects them. And what they found is that, particularly when they were aerosolized and when they were actually directly inhaled, they had the best protective effect. in preventing the coronavirus for these chickens. So for me, the way that I take that is that I plan to use and am using an essential oil diffuser in my home to spray these antimicrobial compounds, as well as putting them on a mask when I go out in public. Please keep in mind, essential oils are pharmaceutical grade compounds. You use so many pounds of materials of plants to make small amounts of essential oils, and people oftentimes don't use them like they're pharmaceuticals, but they are that potent. People will often tout like recipes eating essential oils, which I think is actually really irresponsible. And essential oils applied directly to the skin immediately absorb like through the whole system, and so you really have to watch your dosing topically as well. Also with essential oils, you really always want to use a carrier oil because they can burn your skin otherwise, which is any other kind of almond or coconut oil applied first. And just realize that you don't need to go totally hog wild. I hope that people from this video don't go out and sell all the stores out of essential oils. You can use some essential oils in some small amounts to have some antimicrobial effect. That doesn't mean that you need to buy 40 bottles of essential oils or start investing in the stock market for essential oils. Just a little bit goes a long way. These are my opinions. These are some tips that I'm using for my family. You can take them for what they're worth. Please know that at New Team Integrative Medicine, we are offering lots of telemedicine visits. So if you have further questions, you need some support, we're available to help you and always happy to talk about these things. I hope you're all having a great day and staying safe out there. Bye.